You've just fallen and landed on your hand. You're experiencing pain, bruising, and possibly a reduced range of motion. What is your doctor thinking as they examine you? Today, we'll break down the typical evaluation process after a hand injury. Please note that this information is for educational purposes only and does not represent any specific organization's opinion. Always consult a healthcare provider for medical advice. Doctor's thought process. Initial examination. A common injury after a fall is called FOOSH, fall on outstretched hand. This often leads to pain, bruising, and limited motion. The doctor's primary focus is to assess these symptoms and check for potential ligament damage. They'll also test for any neurological or vascular issues to ensure that nerves and blood vessels are intact. Imaging and diagnosis. Imaging is usually the next step, with X-rays being the primary tool for evaluating fractures. In some cases, ultrasound, CT scans, or MRIs may be used, but these are less common due to cost and availability. If the X-rays show no fractures but the doctor still suspects an issue, they may ask you to return in 7-14 days for follow-up imaging to catch any subtle fractures. Once the doctor has reviewed the history, physical exam, and imaging results, they can make a diagnosis. Let's break it down for both pediatric and adult patients. Diagnosis breakdown. Pediatric vs. adult. Pediatric patients. In children, common injuries include torus or green stick fractures. Torus fractures are stable, while green stick fractures involve the outer layer of bone and may be confused with other injuries. These are typically treated with a short arm cast for 3 weeks. If the green stick fracture has more than 50% displacement or an angulation greater than 30 degrees, an orthopedic referral is needed. Adult patients. In adults, distal radial fractures are common. These are often treated with reduction and splinting, followed by a short arm cast for 3-6 weeks. However, if there are complications like carpal fractures, instability, or neurovascular compromise, a referral to an orthopedic specialist may be necessary. Types of radial fractures. Radial fractures can be categorized into several types. Galeazzi, dislocation of the radial nerve joint. Colles, dorsal displacement of the distal radius. Smith, plantar displacement opposite of Colles. Barton, a fracture with dislocation. Hutchinson, fracture of the distal radial styloid process. Treatment and follow-up. Most fractures are treated conservatively with reduction, splinting, or casting. However, severe cases may require referral to an orthopedic specialist. Follow-up care may include repeat imaging or adjustments to the treatment plan.